2/3 of the world population has no access to diagnostic imaging, heavily constrained by the scarcity of radiologists. The brain is one of the most complex areas of diagnostic examinations and accounts for 1/4 of the burden every year. This is how Cerebriu APOLLO works. Meet Sarah and Jack. They're both experiencing headaches and balance problems. At the clinic, the physician cannot determine anything from such diffuse symptoms and refers them to radiology, where the radiologists spend time carefully choosing the appropriate brain MRI protocol, which is triaged with low reporting priority. The technician welcomes Sarah and Jack, preparing them for a brain MRI examination. This is the current workflow. The technician initiates the brain MRI protocol and performs the examination, after which the images are stored for later reading. Sarah and Jack leave the examination room and wait for the MRI results anxiously. And eventually, the radiologist reads and interprets their images, and then contacts Jack about a high-priority re-examination to further qualify his potential tiny acute infarct. This is where Cerebriu APOLLO comes in. With APOLLO, we help radiology and patients by making the workflow more efficient by analyzing the initial sequences during acquisition. These sequences are analyzed by APOLLO within 60 seconds. APOLLO does not detect any clinically relevant abnormalities on Sarah. The radiologist informs Sarah that there hasn't been found anything to worry about, and that the final results can be expected within a few days. For Jack, once APOLLO has analyzed the flare and diffusion scan, it detects and visualizes a tiny acute infarct in his cerebellum, changing Jack's triage to high priority in need of attention, recommending that the technician immediately takes additional time of flight and T2-TSE sequences to ensure the radiologist has the right images to provide an exact impression in the diagnostic report. Jack is admitted to the clinic. Shortly after, the physician has consulted with a radiologist about Jack, who reported an impression of an arterial embolism. The physician informs Jack about the finding and starts discussing treatment options. With Cerebriu APOLLO, hospitals and diagnostic clinics are enabled to dramatically improve brain MRI workflow efficiency, improve patient triage, reduce scan time and re-examinations, and non-acute admissions. Cerebriu, transforming radiology to improve patient journeys.